Well, we found some new signs going up in some Bay Area hospitals because of Ebola. This one at John Muir Medical Center in Walnut Creek, which tells you if you've traveled to West Africa or been in contact with someone from there, tell hospital staff.
It's just a precaution at this point. We just want people to be aware and so that we do take the best care of them.
One of the side effects of Ebola, fear. Nightbeat's Ken Bastida shows us how social media is being used to treat that.
At the Centers for Disease Control and Prevention headquarters in Atlanta, Ebola experts are using Twitter to inoculate the public against ignorance.
People sound afraid. There were a number of questions about whether or not they may have been exposed to the virus without them knowing.
This animation from Twitter shows between September 16th and October 6th, 10.5 million tweets around the world mentioned Ebola. Fear of the deadly virus soared when Dr. Ken Brantley and Nancy Wrightbull were brought back to the United States to receive treatment in Atlanta. The CDC's social media team was bombarded with questions about whether that risked spreading the epidemic to this country. Most of the inaccurate information involves how the virus is transmitted.
The top three misconceptions that I've observed over social media are the fact that Ebola could potentially be airborne, that it's spread through general casual contact, and that they can get Ebola from people that have not yet shown symptoms.
It really is amazing what you can do when you harness the power of social media. And correct me if I'm wrong here, but it was the H1N1 virus that got the CDC in the game in the first place, right?
Yeah, that's exactly right. That was back in 2009. Let's face it, social media can be used for good or bad. Back then, the CDC had only a few thousand Twitter followers. Now it has more than 3 million.
Amazing. All right, Ken, thank you.